can't see it, but this is a really good frame over here. Hi, I'm Charlie Sauer. I am president of the Market Institute and editor of uspolicy.org. And this video is sponsored by the Market Institute Foundation, so please be sure to check them out. Today we have Jay Kimpton with us, and Jay and I have known each other for 6 to 7 years. And I've done a lot in healthcare policy. I have worked with John Goodman on health savings accounts. I helped write the first bill that after Obamacare that was introduced in the House and the Senate. I've been doing healthcare policy for about 10 years. But when I met 15 years, that's longer than, well, man, you got to keep moving these years up. That's scary. But one of the things when I met Jay is Jay's actually where the rubber meets the road in healthcare policy. And he's a third-party administrator. He deals with self-insured companies. And what I found out is that I didn't know much about where the rubber meets the road in healthcare. And it's, let's call it humbling when you are an economist dealing with healthcare policy. And so I wanted Jay to come here today and to talk to us about what self-insurance is. About 60% of individuals are covered by a self-insured plan, and yet half of them don't know about it. So Jay, will you talk to us, what is self-insurance and why do half of people not know they're self-insured?
Sure. Self-insurance, as you were doing that intro, I was thinking, as deductibles have continued to go up and up and up and up, for a household that has a $5,000 deductible, they understand what self-insurance is because for things underneath that deductible, they're self-insured. Yep. Employers do the same thing though. Employers, self-insurance really in a nutshell is when an employer is large enough and fed up enough with paying an insurance premium to a big insurance company and then hopefully getting their employees' claims paid and everything else, they instead say, I think we're wasting money doing that, and so instead of paying a premium to an insurance company, we're just going to take the dollars we would have sent to the insurance company and keep them right in our business. Yep. And then hire a third party, somebody like the Kimpton Group, to when an employee has a medical claim, goes to the hospital, has prescription claim, those medical bills come to the third party, comes to the Kimpton Group, and we then process that claim and then write the check back out to the medical provider, but we write that check on the employer's money that is right there at the employer. So as opposed to sending your money to the insurance company and letting them hold it, a self-insured employer only pays for the medical claims that their employees actually have. A dollar that's not spent on healthcare is a dollar that stays right there at the employer and hopefully can help reduce the employee contribution. The amount comes out of the employee's paycheck and stays there in the business, which benefits the employer and the employees.
So I knew about self-insurance, but I hadn't really thought it's how does this work? And now, this is something you and I have talked about. This is a layer. It's something that's extra. It helps, sure. But this is an important layer because the processing claims is hard. Yeah. Right. I mean, codes. I don't know how many codes there are, but if a small business, say 1,000, 2,000 employees, is self-insured, they would have to add in a whole team of people to process the claims, and so that's really what you're doing.
That's right. And the federal government, state government has not made it any easier. There's obviously a lot of regulatory compliance that has to be done, but larger employers still do self-insure and self-administer, where they actually do that function in-house. If they all did, I wouldn't have a job. But to answer your previous question, we have 60% of employees that are not on some public plan get their health insurance, their health benefits through a self-funded vehicle, but most of them don't realize it. And the reason is because a lot of administrators, third-party administrators, especially if that third-party administrator is a big insurance companies spend a lot of money on creating that brand identity. And so much so that when they are the one that's just processing claims for your employer, they do not emphasize purposefully that to the employees that they're self-insured and this is not Aetna's nickel or Blue Cross's nickel, that they don't emphasize that, hey, a dollar spent is actually your money. And
Yeah.
it's actually, it's coming out of the same pocket that your employer pays your paycheck out of. And that's really unfortunate. And that's the reason why most employees, when you ask them, well, are you self-insured? They'll go in their wallet, pull out a card, and if it's got a logo on it, they'll say, no, I'm not self-insured. I'm with X insurance company.
Yeah.
We certainly try to emphasize the opposite of that because, the old adage that people take better care of things that they own as opposed to things that they
Yeah.
rent. So we do want to instill an ownership mentality into people's healthcare, the way that they buy healthcare.
And I think that that's the true story of self-insurance. We're going to do another video as well about the free market work that Jay's been doing, and link in the description. If you like these quick explainer videos, please like and subscribe below and come back for more because we will keep putting these out. And thanks for coming.